So Zenitas is a publicly listed company. We relisted in January of 2017. We're a community-based provider of healthcare services and across three main segments of allied health, primary care and home care. We are about a $40 million market cap business. We're led by a strong senior management team and board that have extensive experience in healthcare. So our allied health segment is the largest segment within Zenitas. We have over 40 clinics nationally and 350 health professionals. We offer a range of services from physiotherapy to exercise physiology, podiatry and dietitians. We have over 400,000 customers per annum, and many of our clinicians within our clinics have minority equity. So home care is our smallest division at this stage. We provide services for disability and in-home aged care, plus some respite houses, predominantly located in South Australia with an allied health home care component in Western Australia. But it's one of our segments that will grow rapidly, we hope, in the years to come. Our primary care division are mixed billing GP clinics with complementary care services. We have over 80 GPs within 8 to 10 clinics within Zenitas, and we see over 200,000 patients in those clinics per year. The primary care segment is important to Zenitas. We see them as the coordinator and referral base of care to the other segments. Our strategy for growth at Zenitas is across three main key areas, and that is first and foremost organic growth. We have significant tailwinds in the three segments we operate in this Australian market, and on top of that we will gain more market share through cross-referral and integrating care across the three segments. Our second main key area of growth is rollout, where we'll look to put additional services into our existing sites and roll out brownfield low capex sites with our services in the next few years. The final strategy is acquisition, and we have a healthy pipeline of acquisitions that we're talking to in an advanced stage to early stage. These acquisitions are mainly focused on our home care and GP segments at the moment, but we expect to have further acquisitions in the next financial year. Zenitas had a very exciting first half. We raised 30 million capital to acquire 5 extra businesses into the Zenitas Group to complement our existing Modern Medical Group. We relisted in January 2017, and in the second half we've reaffirmed our guidance of EBITDA 6.6 million for the FY17 year. On top of that, we are rolling out now to 14 extra locations to provide our services across the three segments in other sites nationally. We have all heard everyone talk about the ageing population, and that's very true, but a consequence of the ageing population is the increased incidence of chronic disease. Around 55% of Australians over 65 have 5 or more chronic diseases now. These all bode well for services that we provide in the future. The macro reforms that are also occurring at the government level in Australia bode well for us as a company. We're seeing the public purse move from expensive options of inpatient public hospital care and inpatient aged care to providing services in people's own homes or within the communities they reside. And on top of that, we have a very strong uptake of private health insurance and ancillary services in Australia at about 55%. Our shareholders can expect announcements shortly and over the next 12 months of further acquisitions into the Zenitas Group. We also expect to announce rolling out of our segments nationally for our national footprint. And our vision as a company is to be the leading healthcare provider in the community in the Australian market in the years to come.